Welcome to Her Health First, the podcast where Black women's health is centered, respected, and protected. I'm Tracy. I'm a registered nurse, a healthcare advocate, and a woman who knows firsthand what it feels like to carry too much while navigating a system that was not built with us in mind. Here, we talk about real health, the physical, the emotional, the mental, and the systemic. We unpack what doctors don't always explain. We name what women are often dismissed for, and we learn how to advocate for ourselves without guilt or fear. This is your space to breathe, to learn, and to put your health first. Let's get into today's episode. There's a phrase many women hear over and over again in healthcare. Everything looks normal. And on the surface, that sounds very comforting. But the reality is, for a lot of women, those words do not bring relief. They bring confusion because your labs may be normal and your vitals may be within range. Yet, something in your body does not feel okay. You're still exhausted, you're still dizzy, you're still in pain, and you're still not feeling like yourself. And that's where this episode begins. Because normal doesn't always mean healthy, and one lab value does not tell the whole story. Your baseline is not a single number. It's a pattern. A baseline is how your body typically functions when you feel well. It's your usual blood pressure, it's your usual heart rate, and it's your typical lab trends over time. Two people can have the exact same lab result and experience completely different symptoms. So, when we talk about understanding your baseline, we're talking about context. We're talking about where your numbers usually sit, how they can change over time, and how they match what you feel in your body. You have to think of your body as not a snapshot, but a moving picture. Things are always changing. Healthcare often relies on single moments in time. It's one blood draw, one blood pressure reading, one appointment. The problem with that is that bodies don't work that way. Things like stress, hydration, sleep, pain, anxiety, and our favorite, hormones, all affect labs and vitals. So that's why trends matter more than one isolated result. A lab that's technically normal but has changed steadily over a year is worth paying attention to. So, for example, a blood pressure that's always been low normal but is now consistently higher, even if it's still acceptable, tells a story. Your baseline is about patterns. It's not about perfection. Women are frequently taught to override their bodies. We are taught to push through fatigue. We're taught to normalize pain. We're taught to explain away symptoms. So when labs come back normal, the assumption becomes, if the numbers look fine, then the symptoms must not match. The sad part is, this is especially true for Black women, whose pain and concerns are historically undertreated and underbelieved. So understanding your baseline gives you language. Understanding your baseline allows you to say, this may be normal for the chart, but it's not normal for me. And that sentence matters. You don't need to be a clinician to understand your labs. You need curiosity and permission. So you need to be asking questions like, What is my usual range, or what has my range been? I need to ask, how does this compare to my last labs? Is there a change from my baseline? And what trends should we be watching? As a patient, you're allowed to ask for copies of your results, you're allowed to track them, and you are allowed to notice patterns. That data belongs to you. I know a lot of people go to the doctor and they have anxiety because they feel like vital signs are a test. Vital signs are not grades. What they are is messages. A high heart rate may be telling a story about stress, dehydration, or anxiety. A blood pressure reading may reflect pain, fear, or fatigue. Vital signs should be measurements that open conversations, not shut them down. And when we stop treating numbers as verdicts and start treating them as information, care can become much more collaborative. Your labs provide data, your vitals provide clues, but your lived experience provides meaning. So, understanding your baseline doesn't mean self diagnosing, it means staying engaged, it means noticing changes. It means trusting when something feels off. It means knowing that normal isn't always the end of the conversation. Your body has a history. Your numbers have context. And you deserve care that looks at the whole picture. Before you go, I want to remind you that your body is not the problem. Your questions are not too much, and your health deserves time, attention, and care. If today's episode resonated with you, share it with a woman who needs the reminder that she's not alone. And if you haven't already, follow the podcast so these conversations can continue showing up for you. Until next time, take a breath, take your time, and remember, her health comes first.